I wanted to ask about explants. We look at explants, and we the pathologists look at it so carefully to know. You said you have working diagnosis, and I'd like to know what you would like to, if you are interested in what is in the explant, and what would you like to know about the explants?
Yeah, just for context, less so. I mean, what we all wonder as pulmonary pathologists is, do they even care what we say in an explant? Because the lung is already out, and the patient is already treated. They already have a set of new lungs. Do you care about what we say in the explant, and how does it matter to you?
I do care because we need to be smarter, right? Like um we I want to know if I was wrong, right? Like, because then you can go back and say, like, well, what did I miss that this was fibrotic HP and not IPF, right? Like, I would want to know that. The only caveat to that is there's a delay, right? Like, so I diagnosed someone 3 years ago with IPF or whatever the disease is, and now you're getting the explant 3 years later. So you sort of have to take it with some amount of grain of salt.
Yeah.
But like I don't know, you guys can talk to this more than I can, but my general impression is like when you have RAUIP or HPUIP, there's generally like some features that lead you, like some persistent or residual features that lead you to be like, maybe this wasn't just bland IPF, right? And maybe not, but I think that's helpful if you can give us some sort of hint, or if you come back and say like this was totally stone cold bland UIP,
Yeah.
we were right all along.
Yeah. Just to give you some feedback on your diagnosis.
Yeah, I mean, because we want to know if we were wrong. Like we were talking about before, these diseases are hard to make.
Yeah.
I mean, these diagnoses are hard to make. We want to know what we were thinking,
Yeah.
what we should be thinking.
That's good. We'll have that in mind the next time we look at an explant. Yeah,
Yeah.
it's very helpful.
I mean, that's actually worthwhile about us discussing separately, right? Like
Yes.
any internal patient that gets transplanted and has an explant, maybe we should be having that discussion as a group.
Yeah.
Um, that's a separate project maybe we should do.